Hi, my name is Heidi. I'm a level 1 nursing student. My clinical instructor has assigned me to observe you today.
Excellent. Feel free to ask any questions you might have.
Awesome, thank you so much. I look forward to learning a lot. So you're taking care of a patient in room 622. Can you have time to give me a report?
I sure do, Heidi. I'm going to give you a report in the typical SBAR fashion, which is situation, background, assessment, and recommendation. In room 622, we have patient Ronald Jarvis. He is a 67-year-old African American with complaints of a stage 2 pressure ulcer on his right heel that he noticed approximately 3 weeks ago. He states that it's been getting increasingly worse and more painful. He also complains of difficulty managing his diabetes. He's been a type 1 diabetic for 20 years. He's tried to follow the 1800 ADA diabetic diet and has trouble adhering to it, and his glucose levels have been increasing in the past 5 days. His glucose levels have been in the 300s. His last one was taken at 2030 and was 242. He was admitted for management of his diabetes and a stage 2 pressure ulcer. He has no known allergies. His temperature was 98.4, respiratory rate was 18, blood pressure 145/72. The pulse ox was 95 on room air. His admission weight was 171 pounds and height was 5'11". He's awake, alert, and oriented ×3, cooperative with the exam, and no visible distress. His speech is clear, posture is upright, gait steady, and the patient was well-groomed and appropriate during the exam. His S1 and S2 sounds appreciated without murmur, rub, or gallop, regular rate and rhythm, no carotid bruit. He has clear lung sounds in all 4 quadrants. He's on room air. His abdomen is soft non-tender ×4 with vowel sounds in all 4 quadrants. His ulcer is 5.5 centimeters by 2.5 centimeters in diameter and approximately 3 centimeters deep, extending into the dermis. The wound base is pink. No tunneling, undermining noted, and there is moderate serosanguinous exudate. We put a consult out for a wound care nurse, and he has orders for dressing changes twice a day. With the exception to his ulcer, the rest of his skin is warm, dry, and proper color and elasticity. Morphine was administered for the pain from his ulcer and decreased his pain from a 6 out of 10 to a 1 out of 10. His hematocrit and red blood cell count were slightly decreased. We're still waiting for some lab results to complete, and we're going to continue to monitor his glucose levels along with his wound healing process. He has a medication, regular insulin, ordered, and also glargine.
Thank you so much for giving me a report. Do you mind if I ask you a couple more questions before I watch you demonstrate the medication?
No problem at all. What questions do you have?
Why specifically is the client receiving these medications?
The client is a type 1 diabetic. He's having trouble controlling his blood glucose levels. His last capillary blood glucose, I told you, was taken at 2030, and it was 242. So he needs insulin to bring his glucose levels down to a safe level. Normal glucose levels should be between 60 to 100. Regular insulin is ordered to be given now because it is an intermediate acting insulin that will start working about an hour and a half after it's injected. The insulin glargine is ordered at bedtime because it's a long-acting insulin that is given once a day because it slowly releases small amounts of insulin, resulting in relatively constant effect over time.
What action does this medication have on the body?
Well, the insulin lowers the blood glucose levels by stimulating glucose uptake in the skeletal muscle and fat inhibiting hepatic glucose production.
When should you question administering this medication?
Well, remember that the normal levels of blood glucose should be between 60 to 100. So if the patient's levels are already within this rate, administration of insulin would cause his blood glucose levels to drop to dangerous levels and possibly send him into a diabetic coma.
Do these medications have a therapeutic serum level?
No.
What vital signs should be monitored?
It's important, most of all, to know what your capillary blood glucose level is, but as far as the vital signs, you're going to want to monitor the blood pressure, heart rate, respiration, skin conditions such as color, and the presence of diaphoresis.
What interventions might be taught to the client to ensure medications are administered safely in the hospital setting and then at home?
In the hospital setting, it's important to teach the client how to recognize the signs and symptoms of hyperglycemia and hypoglycemia, and the importance of alerting somebody at the first onset of symptoms. You also want to remember to have the patient eat a meal soon after administration of the insulin. At home, you want to make sure that the client knows how to properly test his blood glucose. He needs to know the importance of keeping his medication with him everywhere he goes. This also includes carrying of glucose levels in case his blood sugar gets too low, and it includes carrying glucose tablets with him everywhere he goes in case his sugar gets too low, and also eating shortly after administration. And he needs to know about proper dosing, administration, and the storage of insulin.
What side effects and potential adverse reactions does this medication have?
Hypoglycemia, erythema, lipodystrophy, pruritus, swelling, and allergic reactions.
How will you know if this medication is effective?
The patient's capillary blood glucose levels will decrease to an appropriate level. The patient will no longer exhibit signs and symptoms of hyper or hypoglycemia. Do you have any more questions for me before we go in and administer the medication?
No, thank you so much for answering all my questions.
Not a problem at all. It's important to know your patient and the medication you're administering to your patient.
Hello, my name is Karis. I'm going to be your nurse tonight, and this is Heidi. She's a student from St. Petersburg College. She's going to be observing me tonight. I'm going to administer your insulin glargine tonight. Do you have any questions about it? No? Okay. Can you tell me what your first and last name is and your date of birth? Okay. Do you have any allergies? No. Wonderful. Okay. So, first thing two, just don't share the birth.
No, it's not that big.
Again, not a problem at all. I'm always here. If you have any further question on the anything, I am going to take some time now and document the application.
Hey, Mr. Lutz, how you doing tonight?
Check the expiration date, the color, the medication.
Hey, Mr. Lutz, how you doing tonight?
It's a proper
Good.
medication.
Doing all right.
And I'm sure you've heard
So
of
I'm here to give you your
the
insulin
five
and pH.
rights.
All right. Can you just tell me your name and date of birth?
Five rights of medication
All right.
administration.
Do you have any allergies?
You have the right patient,
So you just
the
go to
right medication,
compare
right
her name
dose,
to the
right
MAR
time,
here.
and the right route. Okay.
And she's due for
First
her
thing you do
intake, so.
is scan his,
Why are you
Okay.
taking my photo?
and then
Oh, I'm just.
select the medication.
Alright, so can you scan the band?
Okay. And so this is just another check that we do to make sure that we have the proper medication. Okay.
I bought this one
You want to
for
make sure.
$4. I'll break it down.
Alright, the correct is popped up. So then, since this hasn't been working, you gotta enter the barcode in on the mid. So
Okay.
just click right here.
First ingredients here, aspirated
You know how to say epidemic, right? Yeah. What are you doing now?
directly on the 18 units. And then when you're recounting the video, it's really important. You don't want to hold it and stick it on. So you
Alright,
do
so it
what
said
we call the
verify.
scoop method.
So you can now draw up the insulin.
Okay, Mr. Jarvis, I'm going to expose your stomach now. And make sure that you clean up the area really well. You want to go within 2 inches of the umbilicus.
Sure, no problem.
Pinch your skin.
Record it on your phone or?
And then goes directly into the sharp.
So we're given 20 units.
Okay, now that I've administered the glargine, I'm going to go ahead and administer the regular
And
insulin.
then because with the sliding scale, remember what you said, his
So even though we've already scanned his ID badge, since we're administering a new medication, we're going to want to do that again. So we go ahead and scan
Pull
here.
back. On. And get to 6 units of air.
Where you get your needles.
And then we want to scan the medication.
For that, you need to always clean. Do you do this at home also?
And then
You
it's
open up a
important
new
just
bottle
to,
of
you always
Slide,
want
you
to
clean off your
double
bottle,
check,
make sure you
triple
don't have
check
any germs,
that we have
bacteria, or anything
the
get in it.
I do. I clean it every time I take
right
it.
medication,
Excellent.
that we're
Good choice.
administering it at the right time.
In
We
at
want
least
to make
15
sure that it's
seconds.
the right patient, and the right route, and the right dose.
15 seconds.
We're checking this to make sure that it's not expired, and it is not. It's the correct medication, and you just check to make sure that everything matches up. And we've already asked him about his allergies. Even though it says he has none, it's always important to ask him also. Because sometimes, you know, they forget, and it's always important to ask them, you know, again and again.
Now we had drawn back the air.
So, and again, just like before, we're going to want to clean off the top of the medication.
You draw out your
With your diet, right? I saw that in the notes. So
Make
you
sure
know
there's
that
no
I'm going in
air.
and I'm gonna clean the top of these bottles.
We're going to be administering
Depending upon
16
your,
units because his blood sugar was 242.
require you
And
to
according to the
get
sliding
another
scale, that's how much it
nurse
says to
to,
give for that amount of blood sugar.
confirm the dosage,
Now, which
but
one is
so-
the
we do not.
I
You know
pull
which
this
one
back.
is on a
So
slate?
So now we're
16.
going to go to the right upper quadrant, okay, and we have to clean the area.
Push the air in, pull back. When you go to recap the needle, it's really important that you use the one-handed scoop method, Heidi.
Yeah, delete that one. We'll go again.
And according to
One
that,
last shot, and then
it
you
says
go.
16 units.
Okay. Let's get this. Put this closer. So I remember
Just like that.
that. You want your book? It's just going to be. This is it.
So because
Well, I
the
wanna do one
patient,
and done.
because I
Gotta
just
stop and-
administered his other medication in the right side of his stomach,
I will.
it's important to rotate
will
the
be.
sites that
Oh, no,
you
no, 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 once.
inject
I'm
it.
doing it.
Just do yours.
So I'm going
Just do yours
to
today.
clean off this area on the other side.
I'm planning for Thursday already.
Why? Just do yours now.
Okay.
We can keep for 3 hours. It's only
Uncut my
24
needle.
hours. I'm going to be 5 more minutes. I'm going to
Scan.
win this right through.
You're not gonna get the same effect for it. And both
Any of them?
bottles are-
I don't even know where your backpack
is.
It's right here behind the green. So close. So close.
And again, just like the last time, I'm going to put the sharps directly into the sharps container.
I'm watching me told to stick. I'm like,
important.
this is not going to go. This isn't going to fly.
All right, Mr. Jarvis.
Cloudy is your.
It's really important that you alert us if you have any kind of
Here we go.
feelings of if you start to feel
Okay,
dizzy,
we're coming in now.
lightheaded,
We're
or
going to do it.
if you
One
feel
and done.
sweaty,
This is it.
clammy,
Because you know what?
any
The other
signs
thing
and
is-
symptoms of hypoglycemia. You've been a diabetic for 20 years, and we've already spoken about what those signs and symptoms might be. So it's really important that you alert us. You have
Okay,
your food
we're
right
gonna
here
go
by
now
the
and see
bedside.
Mr.
It's
Light.
important to
Knock,
eat
knock.
after administration of
Mr. Light,
insulin.
how are you
Okay.
this morning?
I'm good. How
And
about
your call
yourself?
light is right there. So anything you need, just let me know. I'm going to be back in about 15 minutes
I'm
to
your
check
nurse
my
today. My name's
needle.
Laura, and I brought
All
our
right.
nursing student Caroline. Check to make sure.
Thank you so much for demonstrating a safe medication administration. I just have a couple more questions if you don't mind.
Sure.
If you have any problems,
Were there any potential pertinent pieces of information that you reviewed before administering the medication?
any allergies,
Well,
allergic
Heidi,
reactions,
It's
any
important to
antibiotic
check your
shots,
patient's glucose levels
hypoglycemia,
before administering insulin. If the levels are too low or if too much insulin is administered, it will cause a patient's glucose levels to decrease to dangerous levels. It can cause a patient to become hypoglycemic and possibly go into shock.
Did this information affect how you were going to administer the medication?
As a nurse for the patient, it's important to take caution when administering any kind of medication. However, his blood glucose levels were within the parameters to safely administer the medication.
Did this information affect how you administered the medication?
No, I administered the medication as ordered.
Thank you so much for answering all my questions. I really feel like I learned a lot today.
Again, not a problem at all. I'm always here if you have any questions or if you need anything. I'm going to take a moment now and document the teaching that I provided to the patient and any other things that I did in the patient's room. Do you want to observe me documenting as well?
Sure, that'd be great. Thank you so much.
Okay,